My name is Vijina. I'm a FNP student. Today I'm going to perform the newborn well child examination. So I have baby Mia here. She is 48-hour-old baby. She was born at 39 weeks and 2 days gestation through spontaneous vaginal delivery to a 28-year-old mother who is a G2P2. The baby presents today in the clinic for well child examination, also for hospital follow-up. Mother reported she received a proper prenatal care and the prenatal care was started when she was in first trimester. Prenatal labs were negative for group B, hepatitis B, HIV, gonorrhea, chlamydia and syphilis. And there was no prenatal screening abnormalities reported. Mother denies any gestational diabetes, hypertension, smoking, alcohol, drug use during the pregnancy. Delivery was uncomplicated with no assistance of forceps or vacuum. Baby required no resuscitation and no jaundice treatment required during that period. Apgar score were 8 and 9 at 1 and 5 minutes. Baby weighs 3,400 grams at birth. Baby did not require any NICU admission. Baby received a newborn routine care such as vitamin K administration, erythromycin eye ointment, and first dose of hepatitis B during the hospitalization. And the metabolic screening and hearing screening were performed and passed. Mother reports baby is breastfeeding every 2 to 3 hours with a good latch and breastfeeding on each breast every 15 to 20 minutes. Also, baby has 4 wet diapers and 3 stools per day. Meconium is transitioning to greenish yellow color. Also, mother denies any fever, vomiting and respiratory distress. And since our baby is resting and calm, I'm going to check her respiratory rate. Initially, upon general examination, baby is alert, active, well developed and well nourished for her age. And respiratory rates, upon inspection, baby is not using any accessory muscles. There is no respiratory distress. There is no cyanosis too, and no nasal flaring or grunting. So I'm going to count the respiration the whole 1 minute because newborns are abdominal breathers. So I'm going to check the abdominal rise and fall, and also they have periodic breathing. Okay, the respiratory rate is 42 per minute, and baby demonstrate appropriate abdominal breathing pattern for age, no nasal flaring, grunting or intercostal retractions. So the next one, I'm going to check her heart sound. Upon inspection, the chest is symmetrical, and let me just check the heart rate. Heart rate is 138 beats per minute with regular rhythm, normal S1 and S2. There is no murmurs. A transient murmur from PDA is normal and it will disappear first few days of her age. Capillary refill is less than 3 seconds, and I'm going to check a brachial and femoral pulse. Brachial and femoral pulse are bilaterally equal. So the next one, I'm going to listen the lungs. Lung has a good air entry. It is bilaterally equal, and there is no wheezing, crackles, or any other adventitious breath sounds. So the chest expansion is symmetric and bilaterally. So next I'm moving to check the head. Head is normocephalic, and initially I'm going to check the head circumferences with the use of the measuring tape. And head circumference is 35 centimeters, and baby's weight today is 3,320 grams, which is expected with the newborn weight loss, and the length is 50 centimeters. Vital signs were initially taken when she was in the clinic at the beginning, and blood pressure is 68/43 mm per Hg, and as I mentioned, the heart rate, all those vital signs within normal range for this age. And so I'm moving to the inspection palpation of the head. Upon head examination, the head is normocephalic, no trauma observed. Anterior fontanelle is diamond in shape. There is no sunken or bulging noted. Posterior fontanelle is closed. Sutures are intact, and the head is covered by full of skin. So negative findings for cutis aplasia. There is no missing skin. Next one, I'm going to move on to the face. Initially, I'm going to start with the eyes. Sclera is white in color. There is no jaundice. There is no signs of jaundice. There is no discharges or watering from the eyes. So I'm going to turn the light off so I can check the red reflex with the help of the ophthalmoscope. I'm going to check the red reflex. Red reflex are present bilaterally. And moving to the ears. Upper ear aligns with the outer corner of the eyes. Helix formation is good on both sides, and there is no skin tag or ear pits. So bilateral eyes, ears appears normal. So next I'm checking the nose. The nose there is no distress noted while breathing, and nares are patent bilaterally without any congestion or nasal flaring. Moving down to the mouth. I don't have any gloves, but I'm going to check the sucking reflex. Baby has good sucking reflex, and also absent for cleft lip and cleft palate, and negative findings for ankylosing or tongue tie. If there is any tongue tie, it is impaired the breastfeeding. So next one is the neck. Neck is supple and a good range of motion. There is no webbing of the skin or excess skin. So negative findings for that. And I'm going to palpate the clavicles for any fractures or crepitus. It is negative. So chest examination and lungs examination initially performed. So moving down to the abdomen. Abdomen is abdomen skin is intact. Baby's abdominal breathers, as I mentioned earlier. So I'm going to palpate the abdomen. There is the liver. I'm going to palpate the liver first, and then moving down. The abdomen is there is no negative findings for mass, and at the umbilical cord appears dry. There is no signs of infection, and there is no abdominal hernia. So I'm going to check the inguinal area now. Let me take the diaper off. Femoral pulses present, and then also brachial pulses. I forgot to check it earlier. and there is no inguinal hernia here, and baby's labia majora and clitoris are slightly engorged with the effect from the maternal hormone, and there is no bleeding or vaginal discharge. It may be present, that is something to be expected during this newborn period, initial newborn period. So next one, I'm going to check the hip. There are two manners. It is Ottolini and Barlow manners. In the Barlow manners, abduct the hip and apply gentle pressure to the posterior side, and if there is any clunk sound, that means hip dysplasia present. The next one is Ottolini manner. Flex the hip and abduct the thighs. So it is negative findings for Barlow and Ottolini manner. So the next one I have, I'm going to check the baby's fingers. There are 5 fingers and 5 toes. There is negative for polydactyly. Also there is no transverse creases not observed in the palm. And on the back examination, the skin is, baby has blue and gray macules and erythema toxicum. That is something to be expected. That is normal. And there is no tuft of hair. Also, there is no tuft of hair. Also, there is no asymmetric gluteal cleft. And if there is any deep sacral dimples without non-visible ways, that means baby has any sacral abnormalities. So that has to be further investigated. And the last one, I'm going to check the reflexes. So as I mentioned, baby has good sucking reflex. I'm going to check the Moro reflex or startle reflex. When we put the baby back to the table, baby extend and retract the arms. That means baby has a good Moro reflex. The next one, I'm going to check the rooting reflex. When the infant turns towards stimulation on the cheek. So the next one is palmar grasp. So baby has good palmar grasp and plantar grasp are also present. So physical examination is over. So I'm going to put the baby back to the crib and without any pillows and blankets. And the diapers are dry now, so there is no need to change the diaper. So moving to the health education, it is very important for the parents to teach the health educations. So health education include keep the umbilical stump clean and dry, and if it is wet, make sure it is dry because there is a chance to get infection, and the umbilical stump may fall off in 1 to 3 weeks. And if it is accidentally wet, dry with a soft cloth or cotton ball. And we encourage you to do the sponge bath for the baby. Also make sure babies are feeding every 2 to 3 hours, otherwise it may cause dehydration. And there is a less number of wet diapers or change in stool pattern. That is something to be alarmed. And if there is any fever, respiratory distress, vomiting, seek medical care immediately. And car safety is one of the other stuff I have to mention that is important. So baby needs a rear facing car seat. Also make sure baby is not exposed to any smoking. And